Everybody's had a good sorry about that. Good afternoon, everyone. I hope everyone's had a good start to their week. Our discussion today is on attention deficit hyperactivity disorder, better known as ADHD. So, with this being ADHD month, we felt it was important to address some of the issues about ADHD. So, our topic begins with just an overview, if you will, of the things that we'll be discussing. We'll have an introduction to ADHD and define what ADHD actually is. We'll take a look at the signs and symptoms. We'll take a look at the difference between what's happening with adults versus children, how ADHD is diagnosed, some potential causes, some effects, treatments, and then the goal of ADHD month and ways to support ADHD month, you know, to help bring awareness to the disorder itself. So, without further ado, we'll go ahead and get started. A lot of people have no idea how common or uncommon ADHD can be. According to the CDC, there are over 7 million children and adolescents in the United States that were diagnosed with ADHD in 2022. That's about 1 in every 9 children ages 3 to 17. One estimates that about 4 to 4.5% of the adults in the United States have ADHD, while others estimate that about 8% of adults will experience some symptoms of ADHD in some point in their life. Attention deficit hyperactivity disorder affects all of us. Either we have it, we have children or family members that have it, or we know someone that has it. And so it is more common than a lot of people truly understand. When we talk about defining what ADHD is, it's one of the most common mental disorder affecting children in the United States today. Symptoms of ADHD include inattention or not being able to focus, hyperactivity, which is excessive movement that's not fitted for the setting, impulsicity, impulsicity. I can't talk today, guys. I'm sorry. Impulsicity. It's hasty actions that occur in the moment without thought. Just interjecting for a moment, I have a son that has ADHD. He was diagnosed as a child. And when we talk about the impulsive behavior, at the age of 7, my son decided it would be cool to jump from his second-story bedroom window to a trampoline on the ground below, not thinking, it's that hasty action at the moment. That sounds like fun, so let's do it. And so that is something that you see very commonly in children that have ADHD. They think it, they do it. And so a lot of times that can lead to, as I can attest, lots of emergency room visits. But when we look at ADHD, we have to look at the symptoms. The three main symptoms of attention deficit hyperactivity disorder are as follows: inattention. It's that difficulty to paying attention, daydreaming, zoning out, or overlooking details. The hyperactivity itself, more energy than necessary, moving around too much, or talking too much. And that impulsivity, that's acting without thinking or having difficulty in self control. The example, like I just gave about, somebody jumping out of a two-story window to a trampoline is not something that most people would consider doing, or at least they think about it before they acted. When we talk about adults versus children with ADHD, what we see in children is going to be different than what we see in adults. In children, ADHD symptoms may be more obvious, while in adults, they've learned to either cover them up find workarounds, or they make excuses for the symptoms. In kids or in children, ADHD symptoms can include difficulty listening, fidgeting, blurting out answers. In adults, the symptoms can include poor time management, difficulty multitasking, and restlessness. You know, for a lot of adults who have had to live with attention deficit, it can be very difficult, especially when it comes to multitasking. And on a job, most of us are required to be able to do that on a regular basis. So when it comes to diagnosing ADHD, it requires multiple symptoms that have affected the patient's relationships, jobs, or other important areas of their life. It can be difficult to diagnose in adults because the symptoms look similar to other conditions that occur, like just aging, early Alzheimer's disease, and just having that lack of attention to detail. ADHD is likely present in children, and even if it wasn't known, they kind of subtly go through the motions right through adulthood. An ADHD assessment can include a physical exam, which can help to rule out other possible causes for the symptoms, a series of interviews with you or your child, and interviews or reports from significant people, such as partners, parents, and especially in kids, teachers. Teachers are generally the ones that pick it up first because they spend a great deal of their time with our kids and they see the fidgeting. They see the blurting out of the answers in class or unable to be able to sit still during a test or skipping over words when they're reading. But there's no one test for ADHD. However, doctors can do tests that can rule out other causes and then kind of confirm the diagnosis. Physicians can also recommend screening using screening tools that rate how a child or an adult is behaving, how they respond to certain actions, and things of that nature. So, a medical, physical, or neurodevelopmental exam helps to identify if the child meets the criteria for the diagnosis, as well as for adults. That again includes the hyperactivity, the inattention to detail, and impulsivity. Recording symptoms usually rates the individual's level of ADHD on a scale, and then other resource information and helps to ensure you or your child meets the standard criteria. One of the things that I observed was when my son was diagnosed, of course, questions were asked of his teacher, questions were asked of his father and I, and then they had him play a game, and his inability to focus on his surroundings with that game on helped them to determine that he truly did have attention deficit hyperactivity disorder, which is very different than um, attention disorders. Like you can have ADD instead of ADHD. The component for the hyperactive disorder is what makes them different. Some of the causes. Well, the exact cause for ADHD is not known, but it's a combination of genetic and environmental factors. These genetic factors are highly hereditary, and many people with ADHD have a relative with the same condition. Environmental factors can include brain injuries, exposure to toxins, complications during pregnancy to include smoking, alcohol, drug use, and difficult during the delivery process, as well as lead exposure. I found it very interesting too, as a mother of a child with ADHD, in the event that you didn't know, ADHD kids can spot other ADHD kids, and they generally tend to develop relationships with these children because they feel at home. They feel that they are in the same environment and that they understand one another. And at a birthday party, I made the mistake of having 9 9-year-old boys come to my son's birthday party. And once we got to the movie theater, I found out that every single one of them had ADHD, which, needless to say, ended up being quite the event. But at any rate, when we talk about the effects of ADHD, their social interaction. It can make it very difficult for them to interact socially. That's why these kids find their cohorts, if you will, in crime. And children with ADHD become easily frustrated and they're very impulsive. School and work can be very difficult to perform, and it makes it difficult for these kids to perform well in school or adults to perform well at work, and can lead to poor time management and poor organizational skills. With employment, ADHD can make it difficult to keep a job, as it can be harder to meet the expectations of the employers or the other employees, and being organized and being on time can be very difficult for them. ADHD can cause financial problems and can lead to financial issues such as impulsive spending and draining of a bank account. So these impulsive reactions can cause financial detriment. Some of the additional effects of ADHD are, again, difficulty developing relationships. These relationships tend to be unstable. Mental and physical health. It can lead to poor mental and physical health and may be linked to depression, anxiety, self harm, and even suicidal ideations. For some people with ADHD, it can lead to substance misuse and is linked to alcohol or other substance misuse itself. And accidents. It may be linked to frequent car accidents or other accidents due to their inability to focus. Some of the other effects include sleep issues. ADHD may increase the risk of snoring, sleep apnea, and restless leg syndrome. It can also disrupt the body's circadian rhythm, making it difficult to fall asleep and then making it difficult to wake up at regular times. So when you think about all of these issues that an individual that has ADHD, especially when it comes to adulthood, it can make life very difficult. You lack sleep, you lack attention, you lack um, organizational skills, multitasking becomes difficult, focusing, driving, all of these things can be affected by having attention deficit hyperactivity disorder. So, when we talk about treatment of the disorder itself, this can include a combination of elements: medications, therapy, lifestyle modifications or changes. When it comes to medications, stimulants are the most common medication for ADHD. And you kind of think, why would you give someone who's already hyperactive a stimulant? Well, because it works on the brain's chemicals that help with the attention and thinking, which helps to sharpen their focus. There are both short acting and long acting stimulants available. You'll find that individuals who don't have ADHD, who are taking ADHD medications, tend to be overstimulated. And these drugs for individuals who do not have ADHD can be addictive. Therapies to include psychological interventions such as cognitive behavior therapy or CBT can help adults with ADHD. For kids, behavior therapy, behavior modifications, parent training can be very important in assisting these children with these symptoms of ADHD. The lifestyle changes. One of the things that is very important for people with ADHD is exercise. And you can try to incorporate this exercise into your daily routine. Spending time in nature can also help to reduce the symptoms. One of the things that we were instructed when my son was diagnosed was to put them in martial arts. It teaches them focus, it teaches them discipline, and it teaches them balance. And so those types of exercises have been proven to help children with ADHD. School based programs. There are lots of kids and teenagers with ADHD that benefit from these school based behavioral interventions and academic accommodations. Believe it or not, for a lot of these kids, although they may have attention deficit, they tend to be musically inclined and mathematically inclined. Cognitive training. These programs help to improve specific functions such as attention and memory. So, as you can see, there are treatments available for attention deficit hyperactivity disorder. There's neurofeedback. This non invasive technique uses an electronic device to monitor brain activity and provide feedback to help with self regulation. A lot of people are very much afraid of or concerned about the use of neurofeedback, but it has been proven to have significant impact on kids, especially, and their ability to focus as well. Complementary health approaches. Some of these help patients to manage their ADHD, but it's often best to combine these treatments with other types of options. A specialist, such as a psychiatrist or a pediatrician, can usually arrange these types of treatments. And since this is attention deficit hyperactive disorder or ADHD Awareness Month, we want to discuss the goal. And the goal basically is raising awareness to ADHD, reducing the stigma. Unfortunately, a lot of our teachers have to deal with children with ADHD that haven't been diagnosed, that are not either receiving medications or receiving therapies. And then these children are labeled as being unruly or undisciplined, when in fact it's the disorder that is causing the problem. Same thing can be said for adults in the workplace. By highlighting the resources and support for people that have ADHD, we help to strengthen the awareness, which then in turn strengthens our knowledge and our ability to deal with individuals that have the disorder. Promoting early diagnosis and proper management also is one of the goals, and creating a more inclusive and compassionate world for those individuals that have ADHD is a primary goal. I know this presentation seems short today, but I wanted to give you an opportunity to ask some questions. One of the first things I wanted to tell you is it is important that we show support for individuals with ADHD and do so by wearing orange, the official color of the ADHD Awareness Program. Embracing ADHD, learning more about it, supporting one another and those individuals that have people in their family with ADHD. and plan an ADHD or a community event to help support awareness and treatment measures for those individuals. That concludes my topic. I will now open the floor to questions. You can place your questions in the chat, and Heather will read those out, and I will do my very best to answer those questions for you.
So I know we did have one comment that said their experience with those who are ADHD is that they actually have great attention. What happens is that they are paying attention to something less socially acceptable for the setting or the situation that they're in.
That's generally very true. There, it's kind of like an individual with ADHD isn't capable of focusing on multiple things in the environment. They tend to focus on one thing and then they zone out or desensitize to the rest of the things in the environment. And like you said, generally those things are the things that are less socially acceptable, especially in a classroom environment or a work environment. Any
Are there any questions that anybody has? You can take yourself off of mute to ask the question, or you can place it in the chat.
Heather, would you
Nope.
mind going back and reading that first question that we had? I want to address that. The one that was sent in.
Yeah. Give me 1 second. So one of the questions that we had previously was, what can be done to normalize neurodivergent voices and those with invisible disabilities?
Well, first of all, it's bringing an awareness to the situation, because a lot of times people that have those are diagnosed with schizophrenia when in fact they don't have schizophrenia. And one of the things that is best recommended in that case is providing an environment that allows them to have centralized focus, drowning out the noise or the sounds that they're hearing, to seek help from a qualified professional, such as a psychiatrist or a psychologist, who can, one, help to evaluate the condition, and two, prescribe medications and additional therapies. Maintaining good rest patterns and healthy diet are also very important.
And I think you said, and you addressed the other questions in the presentation.
Well, in case there are any additional questions that you felt like I didn't address, I'll be more than happy to do so. Or if there's something that I said that was unclear, please let me know so I can go back and reiterate, or maybe even change the way I explain it.
Okay, there's one additional question.
Okay.
And before you take it, let me also put some information on there. It says, what other resources are there for ADHDers who are already taking stimulant extended release medication but still struggle with attention and focus? There's what I will send when I send the recording are some additional resources for ADHD. Like there's a program called Attitude, and it's ADDitude. There's some other websites that have all kinds of other resources that are available. So I will send some of that out to everybody, because I know that's something that I've had to do with myself and my children, because all of my kids have a form of ADD or ADHD, as well as myself. Um, so I think this topic hits home for both myself and Terry.
Yes.
So there are resources that are available. So I will get some of that out to you guys when I send the recording.
Also,
But
the
did you want to
American,
add to that?
yeah, the American College of Neurology also has some great resources available to include exercise activities, especially for children, and extracurricular activities for these children help as well. Um, Music, uh, especially things like percussion, the martial arts, things that help them to focus. And one of the first things somebody said to me, so you're going to teach somebody who has difficulty focusing and who is impulsive how to be a black belt, but you would be very surprised at the way that martial arts can help these kids and adults. I personally don't have ADHD, but I am a black belt in Taekwondo. And we saw many of the kids that attended our programs had attention deficit. And by learning to channel that energy and that impulsiveness, they're better able to find self control. And so those are things that are available to these kids. And sometimes, depending upon the studio itself, they offer specific discounts to children that have the disorder.
There's a couple other questions. If someone believes that they may have adult ADHD, what would be the first steps to look into this? I can send the resource when I send the resources with the recording. I can send locate places where you can go that are in the network, where you can get tested. Because if you think you have it, the first you want to make sure you're getting the testing and you actually are able to get diagnosed with it.
Right.
So I can send you those providers that do the testing, so that way you would want to start there.
Yeah, that's great. Any other questions, guys?
One of the other ones, can you describe or provide more information on cognitive behavior therapy for adults? Also, my understanding is that maintaining a routine is difficult for people with ADHD. Is taking medication regularly difficult for people with ADHD?
Okay, that's a more than one part question. Going back to the first part, cognitive therapies include things that help individuals direct their focus. Some of those things are recommendations, believe it or not, by neurologists for things like puzzles. Crossword puzzles are very good. Sudoku, I think it's Sudoku, is that how you pronounce it? I don't know. And some video games are even recommended for children with ADHD because it tones their focus. Um, One of the other thing, cognitive therapies can also include um, music, not necessarily playing music, but listening to certain types of music, things that are very uh, rhythmic. And the second part of the question again, I'm sorry, was
Um, Also, my understanding is that maintaining a routine is difficult for people with ADHD.
yes, it
Does
is.
taking ADHD, does taking medication regularly difficult for people with ADHD?
For some, it is because a lot of these same stimulants act in reversed for a person with ADHD. So it causes them to be lethargic, it causes them to be sleepy, it causes them to have what we call foghead. And so taking medications regularly can be difficult. And most neurologists, especially for when we're talking about children, will say that you give them their medications during the week, but you give them a break on the weekends, or you go 10 days off 2 days, things of that nature. Routine can be difficult for these kids because they don't multitask. And one of the things that was recommended by a provider to me, a neurologist, was um, time prep and providing them knowledge ahead of time when it comes to changing an environment or changing a routine. For example, rather than saying, okay, it's time to go to bed, half an hour before time to go to bed, you make the announcement, bedtime in 30 minutes, and then bedtime in 15 minutes. Okay, now it's bedtime. So you are bringing an awareness to the task that you're moving forward toward. And children with ADHD tend to get caught up in what they're focused on. And so a good deal of their aggravation and agitation comes from when there is spontaneous change.
And to add to that, I know one of the things that works really well with my son is a timer. So he knows that as soon as that timer goes off, after he's been told in 20 minutes we're going to do this, he now knows that when that timer goes off, okay, we're done playing. We can no longer, we're leaving McDonald's and we're it's time to go home or wherever it is else that we're
Right,
going.
right.
And meditation music, believe it or not, I find when I'm at work, there's on YouTube, there's ADHD focus meditation music that you can play that will help us focus while you're working. So I use that a lot when I'm in the office. I'm listening to it now, actually. Are there any other questions? And I know somebody did ask if there are any preliminary tests online that are free or would be going to the site be recommended to get the tested. So you do want to get the testing. But I did actually send through the chat with Attention Deficit Disorder Association. They do actually have an online test that you can take. It's add.org/ADHD-test. So I did put that in the chat for everybody, and I will send that as well when I send the other resources and the recording.
One thing you need to know that is the test online is not definitive.
Correct.
I mean, that testing needs to be interpreted by a medical professional. You know, just if you take the test and a certain percentage of the questions indicate that you have ADHD, that is a open invitation to seek out medical attention for the disorder, not to say, well, I took the test online and I don't have ADHD, or I took the test online and I do have ADHD. So it's a guide to help you determine whether or not you need to move forward with additional medical attention.
Correct, because you do always want to make sure you're getting that medical attention that you need.
Right, because it may require medication, and you're not going to be able to get medication based on the results of an online test.
Are there any other questions?
You've got
Can you
somebody.
hear me?
Yes.
Yeah. Okay, so I am a late diagnosed ADHD individual. Is there anything that anyone wants to know about the experience of being an adult diagnosed with ADHD? I know some of these things. I answered like some of it. Systems are really important. It's less called routines when you're neurodivergent and more called a system of how you kind of cope with the neurotypical expectations of the world. So you set yourself into a predefined path, and if anything takes you off of that course, it can be very difficult to get back onto it, which is why taking medications can be difficult. Because if you don't set hard reminders to be like, you gotta take it. Hey, did you actually take it? You might be distracted by something at the moment you were supposed to take it and you snooze that alarm. And then you can't get back on course. But yeah, so I don't really have questions because I have ADHD. I'm doing this lived experience, but if anyone else had questions, I might be able to answer some.
That's awesome, Rebecca. Thank you. We appreciate that. One of the things too that's real important is your diet. High carb diets are not recommended for people with ADHD. One, of course, sugar, it's believed that sugar makes you hyperactive. It's not so much that you are hyperactive. With ADHD, you have a high metabolism at times. And if you're burning those high carbs for fuel, you're basically adding fuel to the fire, if you will. So it is important to have balanced, healthy meals as well. And skipping meals is never a good thing for anybody, but with an individual that has ADHD, it can be difficult because you're not focused on eating when you're in the middle of another task. And so, did you eat? Did you hurry through the meal? You know, those are things that an individual that has ADHD has to deal with.
And one of the other things that was mentioned, is if you're on a stimulant type medication, you need to have a high protein breakfast.
Exactly. Protein is very important.
Something that is lesser discussed on the side effect list of most stimulant type medications is appetite suppression.
Yeah.
And to the points of nausea, like one particular subset, I think it's
That was one of the things that we found to be most difficult with my son. When he took his medication, he didn't want to eat.
Yep. I get like the thought of eating is nauseating. So even if I am hungry, making myself eat is incredibly difficult.
Right.
So making sure that when you are starting off with taking your medication in the morning, that it's high protein, full breakfast, not a Pop-Tart and run, type of deal will help you get further through the day. Because then with not wanting to eat, well now maybe you're hypoglycemic. Maybe now you don't feel great, you're lower energy, you're getting shaky. And also
Wait, if you could get closer to your phone or your mic, because we can't hear what you're saying.
Oh no. Can you hear me now?
A
It's a
little
little
bit
better.
Oh, okay.
There we go.
Sorry.
Repeat what
I have
you
my
were just
headset on,
saying.
but I don't think it's picking up right.
Okay.
But yeah, the high protein thing in the morning is super important because it'll get you further through the day. So protein and fiber, instead of just like grabbing a Pop-Tart or something really quick and running throughout the day. Smoothies and like nut bars can help. So having the extra easy snacks that are going to get a person through the effect of the medication if they are a type of person that has that side effect. Because a lot of the stimulant medications some are used for treating binge eating disorder because of that specific side effect. And when you can't eat, you will find that you end up not feeling that great. And that also inhibits your ability to do everything that you want to do and need to do. And then you're shaky and you're hyperglycemic and not feeling good.
Right. Rebecca, thank you again for interjecting this information. It's very important that as adults with specific disorders that we help to heighten the awareness of others about the diseases and disorders and also help to bring a very human side to some of the very clinical information that is provided. So I really appreciate your input. Thank you. Anybody else
Are
have
there
any
any?
comments or questions? No?
No, I think that's it.
All righty. Well, guys, we'll give you 15 minutes of your time back.
And I do
And
appreciate you guys joining and also asking questions and participating. That always makes it more beneficial for everybody. So again, thank you.
okay, enjoy the rest of your week, everybody.
All right, thank you guys.